Well, each year, nearly 800,000 people suffer a stroke, and the long-term effects can be especially difficult to deal with. Today, we are joined by Jerad with Stepping Up Physical Therapy to talk about what you can do after a stroke happens. Jerad, thanks so much for coming in.
Yep, thanks for having me.
First of all, what happens when someone suffers a stroke?
Well, what a stroke is, well, the medical term for it is a cerebral vascular accident. So that's the medical term for it. But with a stroke, there's two different types. There's an ischemic stroke, which is pretty much where there's a blood clot. And then there's so what happens is the brain loses blood flow, and then it causes death to the tissue.
Are there warning signs? Because I know action quickly is very important.
Right, yep. So the typical symptoms are one-sided weakness, there's a slurred speech, dizziness, vertigo. Some people can have massive headaches. Usually if anybody has these symptoms, they need to seek medical attention right away. And another thing is usually if you have like a right-sided stroke to the brain, then usually that affects the left side. If you had a left side stroke, then it affects your right side.
Okay, and as we said, it's very widespread. For those that have suffered a stroke, what can be done?
Yeah, so usually every patient is different, So when we see a patient, they present with one-sided weakness, so weakness to left arm, left leg, or vice versa. And so what we try to do is we do more functional type movements with them. We want to do weight-bearing activities. So if we reteach them to bear weight through their arm and their leg, then hopefully that can facilitate movement again. Another thing that they run into is loss of balance. The number one goal is to really prevent falls. And so we'll do balance exercises on them, either on stable or unstable surfaces. Because the overall goal of treatment is to prevent loss of balance.
Obviously, every case is different, but how much success have you seen with these type of procedures?
Really, it depends on the severity. So honestly, there's a window of opportunity. So like if they're acute, they can start PT within 24 hours after the stroke. And so they see better, faster results with up into 6 months. So, and physical therapy it could be 2 to 4 hours or so. As far as treatment. When we see them, if it's over 2 years, then the results might be a little bit slow, but the thing is we still see how they move, and we build on what they can do, because a lot of times there's muscles that we can work and facilitate to make them stronger, and then help prevent falls and make them more functional.
All right, such a very, very important topic. Thanks so much for coming in, Jerad,
and
helping explain it a little bit better to us. You can find out much more about the therapy. Just head to our website, wayne.com.